Hi, I'm Wintley Phipps, and we're here in Haiti to learn about Operation Sunshine. Florida Hospital, Haiti Adventist Hospital, and my neighbor's children.
I've been to orphanages where they're just so overburdened with the amount of babies and kids that they have, and they just don't have the providers for it. So there's not enough food, there's just not enough to go around. The orphanages just don't have money either. It's not like they're supported by a government-supported program or so forth. So it's either they're supported by anybody that's donating to the orphanage. So if there's issues, if there's healthcare issues, they're either waiting for a team to come down during a medical mission to do a visit and clinical visit, or if it's a very acute situation, and it's usually to the point where it's a very acute situation before they go to the hospital, because they just can't afford to take care of all these kids.
As of now, she's 14 months old, she still can't stand, she still can't sit well, she still can't keep her neck straight, you know, and she would love to move sometime, but she can't. People said she's like a retarded child, but I believe God will make her walk. She will become a good child. Hi, baby.
Here, the cases that we see the most are cases that you know, from a statistic perspective, is the most common in Haiti. Diarrhea, malaria, HIV, malnutrition.
Her name is Kashina Francois. She has been in the orphanage last 5 years. And she's a sick girl anyway, but we try our best to keep her in good health. But last week, she got a fever. We try our best to give her the right medicines needed. There was no improvement after 2 days, but we took her to the doctor and she got some other medicines. Now she's getting better, she's feeling better now. But not in good health yet. Tomorrow, my wife has a follow-up with her to the doctor to get checked again.
Haiti suffers from two challenges often found in developing countries: an abundance of orphanages and a lack of quality health care.
Overall, the hospitals are very understaffed to provide the care for the amount of patients that are coming through.
There's absolutely no end to the needs here, and even the resources that are in this country are oftentimes only available for the people that can afford them.
60% of the Haitian population lives below $2 a day. Surgeries are going for, inside our hospital, for a pediatric case, about $662.
Orphanages in Haiti struggle to provide food, a safe place to live, and education for the children in their care. These items can be expensive and leaves orphanages without the extra money to pay for health care when their children become sick.
Pharmaceuticals, at most hospitals you would have to pay for. At most hospitals you would have to pay for every medication. To a second part, if they're unable to take, so for instance, if we say you need to take a 30-day treatment, but you're looking at what you can afford, are they going to take that full 30-day treatment?
And this is possible to fill for fever, for all of them. And yesterday I spent about $100 US, close to. Some of them as families, some are real orphans. Some have a father, don't have the mother. Or even though they have parents, the parent really can't care for them.
There's no services really available in Haiti that you can go back to the government and say, hey, we need to support this orphanage program or these children that are partial or full orphans. There's not really a social service system in place yet. So it's either they have to develop their own social service or they're dependent on donors.
These problems were compounded after the 2010 earthquake.
January 2010 was the date that the earthquake happened in Haiti, where thousands of people, died.
The earthquake happened 5 years ago. Having our entire life, both as institution and as individual, tied into this event.
Florida Hospital believes in Haiti. Florida Hospital believes in the people and the future of Haiti. And so they have developed and created this wonderful collaboration that brings together children in orphanages and the hospital, the Adventist Hospital of Haiti, to provide health care for those children. Volunteers from Florida Hospital will provide annual wellness checks for the children. And when a child is sick, they will be able to receive care at Haiti Adventist Hospital at no cost to the orphanage. Florida Hospital will raise funds through philanthropy to reimburse Haiti Adventist Hospital for the care they provide, both taking care of the child and taking care of the hospital.
What we're focused on is taking care of those people that can't afford them and giving them the exact same quality of care that you would get in a top quality medical center in the United States.
We have a plethora of doctors with multiple specialties, inpatient and outpatient services. We have an emergency department that's also here. We have a pediatric department, and we'll be having a full-time pediatrician. This hospital is known to be one of the strongest orthopedic centers in this whole country. We have a pediatric orthopedic surgeon that's also on site. We just recently opened up our new operating rooms.
This type of program is absolutely essential for the success of an institution like this, because what that does is it establishes a long-term relationship with the hospital for the treatment of the people here. Without those types of resources and this long-term relationship from people, this type of program is unable to sustain itself, and the focus can no longer be on the poor kids that really need resources.
But we think that this also can help inform more people that this can work. We're talking about like 2,000 people that can be supported by this. These are not big amount of money that is used for one kid, and this make a huge difference in their life.
Florida Hospital has provided us an avenue for us to go ahead and do what we do best, and that's to provide care. And through the provision of care, we are able to go ahead and reach a much larger population than we wouldn't have been able to reach before. Orphanages that probably would think twice about sending their kids can now send it without worry. And Florida Hospital, they'll be able to go ahead and meet their mission.
As of now, we're heading to the doctor to see if we can get some care for Esther and Kachina. Especially Kachina has a follow-up today, because last 2 days she went there, the doctor asking her to come back, and so we have to get some more medicines for her. She just needs, good medical care to see, if they can find out exactly what's wrong with her and to fix it. So this is an awesome program which will take off our stress from the past and make it really smooth for us right now. But as you know, the type of treatment she needs will take time and it will take money, and sometimes those type of treatment you can really get them here. I believe the Adventist Hospital can help her to be treated for that kind of health sickness.
Florida Hospital, Haiti Adventist Hospital, My Neighbor's Children, and you. Please contact Florida Hospital Global Mission Initiatives for more information about Operation Sunshine.